Hi everyone, welcome back to my YouTube channel. Today we are going to talk about anatomical planes. So let's start our topic with introduction. Anatomy is study of structure of human body, and to describe the position and movements of body part accurately, anatomists use standard reference system. One of the most important of these is the concept of anatomical planes. These planes are imaginary flat surfaces that divide the body into different sections, allowing healthcare professionals and students to describe location, relationship, and movement with precision. Concept of anatomical position. Before understanding anatomical plane, it is essential to know the anatomical position, which serves as a universal reference point. In this position, body is standing upright, feet are together and facing forward, arms are placed at the side, palms face forward with thumbs pointing outward. This standard position ensures consistency when describing planes and directions. Major anatomical planes are sagittal plane, frontal plane or coronal plane, transverse plane or horizontal or axial plane, and oblique plane. Now let's talk about these planes one by one. So first plane is sagittal plane. It is a plane that is vertical plane that divides the body into right and left portions. When it passes exactly through the midline of body, it is called as mid-sagittal plane or median plane. And when it divides the body into unequal right and left parts, it is called as parasagittal plane. Examples of sagittal plane in practice are movements such as walking, running, or nodding the head that occurs in sagittal plane. Second major anatomical plane is frontal plane, that is also called as coronal plane. Frontal plane is a vertical plane that divides the body into anterior and posterior portion, or the vertical plane that divides the body into front and back portion is frontal plane. It runs perpendicular to sagittal plane. You can see this plane in purple color in diagram. Example of frontal plane in practice are jumping jacks, side lunges, or tilting the head sideways are movement in frontal plane. Next major anatomical plane is transverse plane, that is also called as horizontal or axial plane. This plane is a horizontal plane that divides the body into superior and inferior portion, or this plane is the plane that divides the body into upper and lower portion. It runs parallel to the ground when the body is in anatomical position. Examples in practice of this plane are rotational movements such as twisting the torso or turning the head occur in transverse plane. If you see the diagram, the green colored plane is transverse or axial plane. Next anatomical plane is oblique plane. It's a plane is any plane that divides the body into angle other than 90 degree. As we earlier saw, the sagittal plane, coronal plane, and transverse plane were dividing the body in 90 degree. But when the plane is dividing the body in angle other than 90 degree, that is called as oblique plane. It is not parallel to sagittal, frontal, or transverse plane, or not even perpendicular. It allows the study of structure that do not align with the major planes. Examples in practice are MRI scans that often use oblique plane to provide better imaging of certain organs or tissues. Clinical significance of anatomical planes. Understanding anatomical planes is not only important for descriptive purposes but also for practical applications in medical imaging like X-rays, CT scan, and MRIs are often taken in specific plane to visualize internal organs clearly. It is important in surgical procedures as surgeons use planes to plan incision and approaches to internal structures. It is important for physical therapy and sports science as movements and exercises are categorized based on planes to design training program effectively. It is also important for communication in healthcare as anatomical planes allow precise and universal communication between healthcare professionals. Conclusion of this lecture video. Anatomical planes provide a systemic way to describe the human body structure and movement. The sagittal plane, frontal plane, transverse plane, and oblique plane form the foundation of anatomical terminology and clinical practice. Mastery of these concepts is crucial for students, healthcare professionals, and anyone studying human anatomy, as they ensure accuracy in understanding, teaching, and applying anatomical knowledge. And this was all about anatomical planes. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.